Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm continuing to talk about sickle cell disease. Sickle cell disease is a very common disease throughout the world. It affects mostly black folks, but some other folks are affected as well. Worldwide, there are roughly 300 million folks with sickle cell trait. In this country, you have 3.6 million folks with sickle cell trait. It's 2,600,000 which folks with sickle cell trait and about 100,000 with the sickle cell disease. The percentage of sickle cell disease is 8% in blacks and 8% in Latino folks as well. When I left off, I was talking about the different type of sickle cell crises. And in this segment, I'm going to just mention a couple and then move on to start talking about some of the complications of sickle cell disease. Before I do so, I'd like to interest you in this book that I wrote that came out a couple of months ago, The Best of Clinical Medicine for the 21st Century. It has 110 chapters, 816 pages. It covers modern medicine, not only in this country, clinical medicine, but throughout the world. If you could put your hands on it, you could find it in your local public libraries, as I'm sure, or wherever books are sold, and there are always a few copies can be found in my office as well. Now, the last two crises that I wanted to mention is something called splenic sequestration. It occurs mostly in infant, but it can also occur in adults. What is that? Well, it is a situation whereby the entire blood volume, red blood cell volume of the body is shifted into the spleen, causing the person to go into shock. And you have to recognize this quickly and then quickly get them supported by intravenous fluid and blood and whatever, and then try to get the surgeon to come in to try to take the spleen out. Otherwise, they're just going to rupture the spleen and die. It occurs, as I said, most frequently in infants, and it has to be recognized quickly. And the other sickle crisis that is really deadly that I haven't mentioned is something called acute chest syndrome. It is so complicated, I'm not going to take the time here to bore you with all the finest details of it. Suffice it to say, if it is something that causes severe hypoxia, and you are even giving the patient high concentration of oxygen, you're not able to salvage them if you don't quickly discover it and put them in the intensive care units, and sometimes they have to be intubated and then try to find the underlying cause for it, because when you look at the chest x-ray, it could look like pneumonia, it looks like congestive heart failure, but it's extremely complicated. And if you miss that, well, you're likely to lose the patient. Again, it can be found, there's a section of it in this book in chapter 34 where it describes all the different crises, so you would take a look at it. Now, beginning to talk a little bit about the complications of sickle cell disease. Sickle cell disease affects every single part of the human body, period, because the blood goes everywhere. And wherever the blood goes, the sickle cells, these are the sickle cells, those banana-shaped cells that you're looking at here. This paper is a little cramped up. This is a sickle cell, banana-shaped, half-moon-shaped, whatever you call it. And these cells are very sticky, and they're misshaped, and they clogged up the blood vessels wherever they're supposed to go. They cannot carry oxygen because they don't have the proper amount of hemoglobin for the oxygen to attach to, and they don't live in the human body circulation very long, sometimes 15, 20 days max, as compared to the normal red blood cell, which is a disc shape, which lives 120 days. The normal red blood cell is created in a way so that it is able to squeeze through all caliber of blood vessel, no matter how tiny, because it gets squeezed through it because of the way it is shaped. However, these cells here, they can't. very sticky, they're stiff, when they get into the vessel, they clog it up. And there's a traffic backup, as it were, and it's very difficult to mobilize that. When they get clogged up in there, first of all, one of the things that occurs, as it turns out, is the fact that there's a cell to wall vessel reaction. That is, when these cells get stuck to the lining of the first lining of the blood vessel, which we call the antemia, the fact that it stays there and attached to it causes a local reaction that leads to a local inflammation. That local inflammation further damages the blood vessel itself. Not only that the cells is bad, it's clogging the vessel mechanically, preventing blood flow to take place properly. But the attachment of those cells to the walls of the blood vessel create a local inflammatory reaction. And wherever there is chronic inflammation, you're going to wind up having plaque development, which further compromises the blood vessel. Okay, so that's the basis that leads to the devastation that the sickle cell disease causes. Now, last few shows, I was talking about the red blood cell biology and all this other stuff. Now I'm going to talk about the clinical implication and damages that these cells, because of the way they're shaped, cause in the body. I'm going to start with the brain. Okay? All you have to do is have sickle cell disease. You're going to wind up some significant damage to your brain if you live long enough, no matter how well you're being cared for, etc. The reason being that the cells, the way they're shaped, they clogged up the tiniest little vessels inside the brain, creating, as I just mentioned, this backed up, causing this problem, resulting in plaque formation to begin with. Acutely, the cell can just clog up the system and cause all sorts of devastation, but chronically, you wind up with what's called ischemic brain disease, secondary to microvascular problems in the brain. Microvascular, I mean the tiniest little vessels in the brains are damaged, so you're having recurrent mini stroke, as it were, all the time in the brain. And this individual then will present with recurrent headaches, dizziness, and they can, of course, have seizures as well as a result of that. Chronic lack of oxygen flow can lead to dementia, which can lead to poor memories, etc. So this is the problem. And of course, long term, as these conditions persist, you wind up with stroke. Yes, they can have major stroke. Anyone who has microvascular disease of the brain is predisposed to having a major stroke at any moment. If you factor into that, sickle cell disease affects folks that have a high propensity of developing high blood pressure, such as black folks, Latino folks, and other minorities, for a multitude of reasons. Lifestyle, genetic inheritance of the hypertension gene, obesity, stress that they have to cope with, not only stress of daily life, like all human beings have to deal with, in particular those who are living in the developed world with the activity, the fast pace of the world that we live in. And you factor into that high cholesterol, high blood pressure, obesity, because the sickle cell individual is not immune to having all these other diseases that other folks have, diabetes mellitus, etc. So you have an underlying significant blood problem, because nowadays, because of the quality of care physicians are providing to people with sickle cell disease, people are living and mature age. I saw a patient in my office yesterday who has sickle cell disease. She's 76 years old, and I've been taking care of her for years. And all the time that I've been taking care of her, I have never, let me repeat that, I have never had to admit this patient to the hospital. You go figure that out, because I'm hands-on providing the type of care that I provide. And you have people, you can't keep them out of the hospital. They're every month, every couple of weeks, they're admitted to the hospital. I have patients in my office who have sickle cell disease that I agree to provide care for that have not been admitted to the hospital in the last 10, 15 years under my care. And I have patients, like I said, 76 years old in my practice with sickle cell anemia that I'm providing care for. So hands-on medical care and the modern way of the care that we provide to these individuals are able to keep them alive for a very long time. So that being the case, then you have all the other diseases that I just mentioned coupling with the underlying sickle cell disease, resulting in organs of different types being affected even more so. So that's the brain, okay? Microvascular brain disease resulting in recurrent transient ischemic attack, leading with severe headache, dizziness, seizures can occur, causing major stroke can develop, as well as dementia secondary to recurrent lack of oxygen that the brain is suffering from. Okay, now we go from the brain, let's go down to the eye. This way we don't forget anything. Okay. Everyone with sickle cell disease, all of them, have a propensity of having significant eye problem that can lead to glaucoma, cataracts, retinal detachment, all sorts of major complications of the eye. For a reason that's not clear to me or to medicine at large, those who have sickle cell C disease, remember you have sickle cell trait, you have SS, you have SC, you have sickle tau. Individuals with SC disease have the propensity of having the highest problem associated with the eye. Not clear why that is, but that's a known fact in clinical medicine. So these individuals, therefore, have to, again, remain under the care of an ophthalmologist very constantly, really, because, again, the older they are, the more they're likely to have diabetes, which can affect the eye. The more they're likely to have high cholesterol, which can affect the eyes. The more they're likely to have high blood pressure, that can affect the eye. So they have all these problems. So if you're going to keep them alive, which you should, using modern technique of medicine, then you also have to constantly paying attention to all the other problems. Having nothing to do with any of these other things, there's a sickle cell disease itself can cause significant damage to the eye. So eye problem is a major issue in an individual with sickle cell disease. Okay? So now we're leaving the eye. Let's go down to the heart. The heart. Okay? The body cannot survive without the heart. Well, all you have to do is have sickle cell disease and live for any significant number of years. You're going to wind up with significant heart disease. Okay. The first problem that's going to happen is the fact that the heart is going to be affected by these cells circulating to the coronary arteries, getting stuck there because they can't go through very easily, and the number of time the number of time they stay there attached to the vessel, that local reaction will cause inflammation in the coronary arteries. The next step following the inflammation will be plaque formation. Wherever there's inflammation, there's going to be plaque formation. No matter where the inflammation is coming from in the body, it's eventually going to wind up in the circulation of the heart, and you're going to wind up with plaque formation. Okay? Now, once you have plaque formation, that further narrows the blood vessels. So the circulation is poor. The end result of the poor circulation is ischemic heart disease. And once you have ischemic heart disease, then of course, patient can have a heart attack. That's one basic mechanism that is inevitable. The next problem that is inevitable, the fact that these patients' red blood cells are hemolyzing all the time. That's the nature of the disease. Well, the iron they're dumping into the system, the blood system, some of it wind up in the wall of the heart. So you've got iron deposit in the wall of the heart, causing enlargement of the heart. Once you have enlargement of the heart, it is inevitable what's going to follow is congestive heart failure. Okay? So you wind up with ischemic heart disease secondary to the sickling phenomena and the chronicity of it. That leads then to plaque formation that causes further narrowing of the vessel, resulting in ischemic heart disease, which can lead to a heart attack. Plus, on top of that, the patient have to be, by necessity, they're hemolyzing. That's the disease, they're hemolyzing. The red blood cell doesn't live to its 120 days supposed to, so it lives 10, 15 days, it has to empty its content, and that is get dumped into the bloodstream. But there are a lot of material being dumped there. Among that material, of course, is the iron that the red blood cells are carrying. So you're going to have secondary hemochromatosis resulting in cardiomyopathy associated with the iron dumping onto the wall of the heart. If that wasn't bad enough, then you wind up with all this multitude of activities taking place in the heart. They're all abnormal. You wind up with significant cardiac arrhythmias of all types, from atrial fibrillation to ventricular tachycardia, heaven knows, heart block, all the rest of it, okay? So these individuals, therefore, have to remain constantly under the care of someone who understands cardiology, be it the cardiologist or an internist who have facility in terms of knowledge on how to deal with these things. Otherwise, you got problem. Now, again, the same thing applies. The longer these individuals live, the more they're likely to become hypertensive, because the incidence of hypertension in black folks, in particular in this country, all you have to be, in my mind, as a clinician who's been at this for 42 years, is be black and live long enough, you're going to develop hypertension, period. That being said, 1 out of every 3 black folks in this country suffer from hypertension. The rest of the population is 1 out of 5, but black is 1 out of 3. So the most common disease in black folks is hypertension. And I'm here to tell you, as a medical educator and practitioner, of all the diseases we have in this country, the easiest disease to diagnose is hypertension in anyone. And what disease gets the poorest treatment in this country? You know, number 1, hypertension. To this day, those folks who are educating young doctors refuse to adhere to the fact that hypertension is a genetic disease that began in Africa, resulting in a gene that is located in the human being's kidney, regardless of the person's ethnicity. The gene is G protein receptor kinase type 4. When I wrote my first book in 1992, I proposed that concept. I hypothesized that. And some 18 years later, those powers to be that's doing basic research, which I'm not, sure enough, went on to prove it. They discovered the gene. They discovered that gene in all 3 ethnic groups, and all, because it was done in white, it was done in Japanese, and it was done in African. So those 3 ethnic groups, okay? And the gene is the same quality, the same quantity in the kidneys of all these three groups. And what is the reason? What does the gene causes? Salt retention, resulting in essential hypertension. That is the basis of essential hypertension. So if you're going to treat hypertension, the first thing you got to do, therefore, is to provide the individual who has a functioning kidney a thiazide diuretic as a step one to get rid of the excess salt that the body is holding it. As far as the body is concerned, we meaning human beings in the world, are still living in ancient Africa. People don't like to listen to that stuff. This is not racial talk. This is classic scientific talk that's been proven by all the major universities in the world. But I don't want to listen to it because people are so tied up with this racial thing in this country, they don't want to listen. So when somebody shows up in the offices with blood pressure, they take a prescription pad, they give them a beta blocker. What is the beta blocker is going to do to treat somebody's high blood tension who doesn't have pheochromocytoma, who doesn't have vascular hypertension? What is it going to do? Nothing. But causing them side effect, making them sleepy, tired, etc., etc. It's a great medication, but not in this setting. And I don't care about the ethnicity of the individual when it relates to blood pressure because it's all the same. Therefore, you must treat everybody the same as long as they have functioning kidney. They're not listening. I know they're not listening because I'm still seeing patients coming from other doctors who are highly reputable, excellent doctors. They have to come to me to begin treatment of blood pressure. They've been seeing other doctors for 10, 15 years. They can't control the blood pressure. I don't have to do anything extraordinary. Just change medication around and start them with a thiazide diuretic and then change things around. I mean, after all, clinical medicine is not a science, it's an art form. They're not listening. I don't know who taught them medicine. I don't know who's teaching. I have no idea what's going on. It is frustrating because this is why you have such a high incidence of stroke and heart attack in this country, because the people, first of all, many of them don't go for care because they can't afford it or whatever. But it is disgusting when they do go for the care and the people whose responsibility it is to provide the care for them is not doing it properly. So if they have underlying sickle cell disease and they have high blood pressure, which is maybe 10-15% of the time, it sounds crazy, but that's true, it's going to be well controlled by these doctors. So therefore, these people are walking around with elevated blood pressure. Those that do go now, those that doesn't go, you can't blame the doctor. They can't grab people in the street to come to your office. They didn't go. But of those that go, I want you to understand that that's the literature. Less than 25% of the people who are going to are getting the blood pressure is controlled to 130/80, 120/70, etc. This is in the literature. It's in this book as well. Quoted them. This is not me saying so. This is not big mouthing. This is the fact. And the worst part of it, this is the only disease in this country that has a committee that supervises it. And the committee put out the report saying all the stuff that I'm saying right now. It's a national committee of experts. They still don't want to listen. The drug companies have listened. They've gone around, they changed their medication. They attach an HCTZ to all these calcium channel blockers. Several of the AB have HCTZ attached to them. And then, a worst part of it, there's a big study. I don't know who these people are. Big study called the M.A.C.P study that was done in England and in Scandinavia. That clearly involved millions of folks because these people have complete control of the people they're paying their health care for. That clearly shows that beta blocker does not work to treat essential hypertension. And yet, I'm seeing it a couple of weeks ago, coming to my office on a beta blocker, hypertension. And it's supposed to treat the blood pressure. It ain't going to do it, okay? So, and beta blockers are fantastic medication for a whole host of other stuff, but not to treat essential hypertension. So, Folks have all these underlying problems, including sickle cell disease, which is what I'm talking about in this segment. They're already compromised, and now on top of that, they're hypertensive, and they're not being treated properly. Either they're not being treated at all because they don't have insurance or whatever, and if they do go for the treatment, it is disgusting that they're not getting it properly. I don't care if people get angry at me. They can go right ahead. You know, I'm not going to apologize for the truth. So, therefore then, what happened to the heart? The heart gets beat up even worse. You have iron deposit, the sickling phenomena around the vessels. The blood pressure by itself is high, having nothing to do with the sickle cell disease. The fact that the type of individual that have the highest propensity of blood pressure, so they have that superimposed on that. And God forbid if they happen to be obese, which is an epidemic in this country, they have that on top of that. And they wind up with high cholesterol. They wind up with diabetes. Now, what chance do they have of surviving a healthy life? Zero. Absolutely zero. So therefore, they're dying all over the place. Okay. And the people who control the purse in this country and the insurance companies put all this medication on a formula that you have to use for these folks, and they did not change, they did not realize that these folks whose money they're taking every month, these medication, most of them are not appropriate for these people. I've gotten into the fight. I've written the letters. They don't care. They want you to prescribe this stuff. How can you ethically, professionally, prescribe a medication for a patient that you know is not going to work? That's what they want us to do, and I refuse to do it. Okay. I'd rather give the patient money out of my pocket to buy the good medication. Listen, I'm going to stop here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.